Hey LiveActive community, it's Dr. Hasib Ahmed here with LiveActive Primary Care. Today we're going to be talking about the true value of direct primary care, what that means for you as a patient, your loved ones, and your family. So let's get started. Right, there are two main benefits of direct primary care, and I'm going to try to really simplify it. There's a lot of videos on YouTube about direct primary care, so I'm not going to spend too much time on that. But I'm going to talk about some real facts and some real instances where it can help you. And I'm going to start off sharing a story. A patient that actually called me just a couple of days ago, interested in our practice, and just got his health insurance. And so he literally said, "This is new for me. I have no idea how to navigate the healthcare system. I'm very confused." We hear this a lot, and this is why doctors like myself do what we do, is because even though you have that plastic card, it still does not mean that you will have good health care, right? Or even have health care. There's prior authorizations, there's delay in cares, there's networks, it's complex. And this individual was basically asking me about a referral or a good source of referral for a specialty service. And I said, this is exactly why we do what we do. I mean, what you're talking about, even if you see your specialist, you're still going to be directed back to your primary care doctor, your quarterback, to help take care of issues. So each specialist is going to be looking at that particular issue that you go to them for. So number one is navigating the healthcare system. That's what primary care doctors are good at. That's what they specialize in. Hospital medicine physicians, internists, the extra value we bring, of course, in the primary care setting is that we know what chaos looks like. We've managed it. We know what it feels like, looks like. We can almost predict when it's going to happen, and so our job in the primary care setting is to prevent that chaos from happening. And that's the value of finding a internal medicine physician or a physician that's skilled in the hospital side as well, so that's very important. Number two, when we talk about navigating the healthcare system, is we have to get away from this mindset that I just need to go ask the specialist, this one question. I just need to go to another specialist for this. Well, the more cooks you have in the kitchen, the more confused you're going to get. We're all trying to make the same dish of improved quality of life, improved longevity, and help you achieve your health goals, right? So if you ask 10 people, you may get 10 different answers. Medicine is an art. It's not a algorithmic cookbook medicine. There's no such thing. Each of us has a story, and the care and the health decisions have to be tailored to what is going to bring you the most benefit and the best outcomes. And so each person is unique. You're unique. So you don't fit into every research study or algorithm or standard of care out there. Those are all tools in our toolbox. So that's why primary care is so important, is to be able to navigate the healthcare system. Number two is just the clear benefits. Of course, we focus on cost, and we talk about, it's a monthly membership fee. It's less than the cost of coffee a day. We say these things. Unfortunately, a lot of people call my office after they've gone to the ER, they've had some bad experience, they've been dealing with an issue and not getting the right answers. And just today, I spent much of my time reviewing a very complicated case for a new patient of mine. But again, direct primary care gives me that time to review all the records from their hospitalizations. I reviewed every imaging study that they've had, from echoes to CTs, to also clinic notes, and I put the story together. And the daughter was so impressed and so appreciative that I had read the entire medical story of her mother. And so our first visit today was 60 minutes, but I went through and I said, to the point of, I even said, you quit smoking in 1970. And so she said, you even read that? And I said, yes. And so when we have the time to review records to that detail, and know, again, we talked about her mitral valve, and her cardiologist, although yes, she's elderly, she's not a surgical candidate, but they never had that conversation about why the mitral valve was not being addressed. So to me, that's a problem, right? So we focused on atrial fibrillation, her arrhythmias at those cardiology visits, but we didn't talk about her valve. We assumed that, yes, she's not a surgical candidate and she doesn't want surgeries herself, but there's no documented note that kind of said, hey, we talked about her valve and she does not want surgery. So that was pretty interesting for me to learn today. But having that time to read about patients and learn about patients and then interacting at that level, you need time to do that. And that's the value of direct primary care. And unfortunately, it's not something that I can quantify for you. I can show it in data. Certainly, we show improved outcomes in direct primary care. We show patient satisfaction, of course, and reduced ER visits, reduction in costs, and overall cost savings for families. There's some papers out there regarding that, but it's always hard for people to truly understand it until, unfortunately, they experience the chaos of our healthcare system. So please reach out to a direct primary care practice that's near you to learn more. Every direct primary care is different. I hope you find the right physician for you and a good healthcare team so that you live long and reach your healthcare goals. So take care, God bless, and I'll see you at the next video.